Paul. Thank you so much for joining us. And again, my name is Professor Nora Colton, and I am the director of the Global Business School for Health. I've also got Karina Rajani, who's going to talk to you about the student experience here at GBSH and also on this program. So to begin with, I'd like to just take you through some slides. Just a few housekeeping rules. We are recording this session. You'll see down below that you've got a Q&A function. It's very important if you want to ask a question that you put that into the Q&A. And so without further ado, I'm going to start to take you through these slides. So first of all, before I talk about the program, I just want to talk about the Global Business School for Health. We're in our second year. We've been growing very rapidly, and we're the first business school in the world totally dedicated to educating the next generation of health and healthcare managers and leaders. And our thinking is that many of you will know healthcare across the globe is seeing numerous challenges. Of course, there was the pandemic, and that highlighted many of the inadequacies in terms of our therapeutics, our hospitals, our healthcare. But moreover, the world is facing numerous challenges, and so health is taking on a much bigger importance in different countries in the world. So, for example, we now talk about the new health economy. Health is growing at such an exponential rate that it is actually the leading sector in many countries. If I look to places like the United States, we can see that the health sector in terms of labor force is outpacing all other industries. So we need clever managers and leaders, people who can think about how do we create the right pathways, how do we change our model focused on therapeutics of just treating people, and put more emphasis on prevention and diagnostics. And that is a question for leaders and managers. In fact, much of the research that I do today focuses on looking at the role that senior leaders play within their organization. And I can assure you that in healthcare organizations, good managers and leaders are integral to performance and good outcomes. So that is the ethos. That's the kind of thinking behind the Global Business School for Health. Then the other really important ethos is that if we're going to solve these problems, we can't continue to educate you in silos. So many of you will have done very specific bachelor's degrees, but as we go into your master's, we need to give you a wider perspective to look at many of these issues. So the Global Business School for Health is very interdisciplinary. We focus on challenges and health challenges rather than on disciplines. We have a very multidisciplinary faculty, as well as people from all over the world. We truly take a global approach. Although we're in the UK and we think about the National Health Service here, our emphasis is really about the world and thinking much bigger and about different countries and trying to understand how different health systems work. There is no perfect health system, and we can learn from each other through a process of sharing across your program. So this is also very important to us, to be focused on the challenge, to be asking the right questions and trying to find the answers, not worrying about narrow disciplines and silos to educate you. So the Global Healthcare Management program, I think, is probably one of our best, if not our best program. And I'll tell you why, because we designed this program with employers. We brought employers together. We did extensive surveys for this program. And we asked employers, well, what do you need in leaders and managers? And they said they needed leaders and managers who could be courageous leaders, who had good leadership and management skills. They told us that they needed people who understood analytics, who could understand data science and make a difference in their organization through leveraging that understanding. And then last but not least, finance, because much of what separates different health systems is the way that they're financed and the financial models that they use. And in fact, many of the issues in different health systems has to deal with the finances. So in this program, you will get core modules. Those core modules will give you the foundation that you need, regardless how you segue into a healthcare organization. And then those specialized modules will help you add extra value wherever you end up working. Now, these are really intended, this program, for managers, for leaders, for people who are going to be at the helm of businesses and healthcare organizations. So you'll learn a lot about the contemporary healthcare landscape. You'll develop better leadership and management skills. And I can assure you that that starts with self-awareness, understanding how to manage yourself, understanding how you do that in a high pressurized organization like healthcare, and learning good habits, because we always, in a crisis, under pressure, go back to our instinctive habits. You'll also learn about the principles and practices within management from different kind of global lens, and you will get skills that cross numerous areas. So you'll get skills, and I'll talk more about this, but in kind of finance, health economics. You'll understand and take a course in comparative health systems, and you'll also get those crucial HR and organizational development skills. So this is really to give you a base and then to give you a specialization. Now, also, just before I go on to talking about the admissions, in each of those specializations, again, you'll take 4 modules, and those 4 modules will help you gain competencies. So at the end of the day, you'll be fit to be a manager, leader, a consultant in the healthcare space, but you'll have within that a very important niche. And that niche can be in that kind of analytics, data science area. It can be in the finance. And by finance, it's not just, you'll learn about operational finance, how to run a hospital type finance, but you'll also learn about the investment environment. And that's very important, as well as financial risk management and how that works within a healthcare setting. And then, of course, in leadership, you'll also get strategy. You'll learn how your strategic decisions, your thinking, your values, all of that influence your organization, alongside understanding how power works and how to get the most out of your employees by coaching them and leveraging innovation and change management. So these programs are really designed to give you a very rich skill set. In terms of the admissions and entry requirement, you'll need a 2-1 or above, and that can be coupled with extensive relevant work experience. And that if you don't have a 2-1, that will become integral to the decision-making process. Also, you need an IELTS at level 6.5 or above, and no less than 6 in each area. You'll write a personal statement, and we do read those personal statements, and they do matter. So take your time, make sure to focus on why you would want to do this program. We take students from lots of different backgrounds. What we're very focused on is making sure that they've got the right intent. And then, of course, a letter of recommendation. So, as I said, we're looking for people. You can be a recent graduate. You can be somebody who's been out in the workforce for a while. But we want people who are looking to excel their management and leadership skills in a healthcare setting. We are very keen to help you on your development journey, become the very best that you can be. So now I'm just going to go over the program structure with you in a little more detail. As I already mentioned to you, you'll have core modules and you'll have specialized modules. So how will that work? Well, first of all, before you ever arrive, you'll be invited, by the way, to take a self-paced course in global health systems. Again, an opportunity for you to gain some more background, especially if you're not coming already from a healthcare background. And we also have quite an intensive induction week that will give you lots of opportunities to start planning. And I always encourage you and students to plan, you kind of professional development plan as you go through this program. And then in terms of the structure, so how does that work? So in the first term, you'll take 2 of your core modules. And those first 2 you'll take is leadership and management of healthcare, which is essentially healthcare management. You'll also take a module in economic and financial evaluation of healthcare. Again, very focused on health economics. And then you'll take 2 in your core specialized area. So if you're specializing in finance, you take risk management and accounting and finance for healthcare. And if you're taking analytics, you'll take 2 analytics modules. And I just want to mention that our analytic track is taught with the Institute of Health Informatics. So those would be courses that you would take with them, and they are offered in a blended format. And then if you're taking, leadership, you'll take strategic healthcare leadership. That's taught by me. And you'll also take a course on power and politics in healthcare. So that's how term 1 will feel for you. And you'll also, by the way, on Wednesdays, so Wednesday afternoons, we do not book any modules. Wednesday afternoons are used to, have extra classes or extra activities. And so in term 1, you'll start actually your term 3 business project right at the start. So in term 1, you will on Wednesdays have a number of workshops across the term to help you start to develop your entrepreneurial skills. So what is that business project you're going to do in term 3? You're going to take an idea, you're going to develop it. It's going to be about either improving healthcare or an innovation or idea for health. And you'll work in a group with other students, and you'll take that project from concept to business case. We have this year, we have dedicated Wednesday workshops that the students will attend to help them develop that. And then you'll be assigned a group and you'll work on that project. And what you'll do as your final assessment for that module is you'll have a business case along with a pitch. You'll pitch the case. Then if you're, so you'll get those workshops for the business project in term 1 as well. Then in term 2, again, you'll take 2 core modules. One is called Comparative Health Systems. It's an opportunity for you to learn much more about population health, how health systems differ, why they differ, learn about some of the hot topics, as it were, within population health area. And then you'll also have a module on organizational behavior with human resource management focus. And then again, you'll take 2 of your core. Now, why did we structure it that way? Because we want you to have the opportunity not to just get to know the people that are on your route, your stream, your specialization, but also to get to know people across your program, Global Healthcare Management. So you'll get 2 of those specialized ones. And then finally, least but not last, you'll start to think about your research project. You'll have some opportunities again to attend some workshops, some training to prepare for that. That's an opportunity for you to take a topic. And I just finished marking some of these research projects from the first cohort. Excellent work, some tremendous, papers and projects. And again, so that's an opportunity for you to think about what you want to work on, a topic that you want to really expand, that's really energized you across the year in terms of your program. Now, the other thing I want to just briefly touch on is scholarships and funding. We do have some GBSH scholarships. We're constantly looking to increase those and enhance those. And in this next year, we'll be advertising and offering these These are two that we offer: Women Healthcare Leaders Scholarship and also a Global Healthcare Leaders Scholarship. All students, international home, can apply for these scholarships, so we'd really encourage you to do that. Also, if you're here in the UK, you can always apply for a graduate taught funding programs. There are loans that you can get and funding. If you're coming from the United States, there's also federal funding that you can again get. There's also various other international student scholarships, including the Chevening, the Commonwealth, Fulbright, GRADE, and master's bursaries. And we also have at UCL, so if you Google UCL Scholarship Finder, you can pull up this website and you can search for scholarships that you might be eligible for. So, and I always recommend that if you're going to go for a scholarship, that you go early as possible so that you can have a great chance to get that. If you're applying for one of our scholarships, make sure you apply for the program. Don't wait to get the scholarship because you know, you need to do those simultaneously, and you usually need to get into the program to get the scholarship. Also, you know, UCL East, where our campus is located, is going to be offering a number of scholarships. So make sure to take advantage of those as well. In terms of careers, there's lots of opportunities for you to engage. And starting in the first week, we run a career event. The university, the UCL Career Service, has a number of excellent events. If you're interested in being an entrepreneur, we have Innovation Enterprises Services. There's also a UCL Alumni Network. It's really about getting engaged. And Miriam Kiani is our master's careers person within the school. There's also one at the faculty level, and of course there's UCL Careers, and she meets with students all the time, one-on-one. I always say to students, if you want to have a job before you graduate, you need to actually start at the beginning of your program looking for a job. Some of the career destinations are consultancies, so students going and working at different consultancies. There's also opportunities in terms of pharma, biotech, public and private healthcare space, so the NHS, BUPA, the WHO. There are all sorts of organizations. So this program will open many doors for you in lots of different settings. So it's up to you to think about how you want to pitch yourself, how you want to pitch your CV, and where do you want to go. There are many health techs and med tech startups here in London. And in fact, we've had a couple students now here from our last cohort win opportunities to be part of the UCL Hatchery and take their startup business ideas that they developed while on their programs. One of them from the Global Healthcare Management has a great project and an app, and she has recently won 2 years of space and support at the Hatchery. So that's another option that you should always think about. Then, of course, part of coming to a place like UCL isn't just about being in class and getting content. It's about being part of London, being part of UCL. So at UCL, we have over 250 clubs and societies. We have lots of opportunities for you to interact and really engage in this dynamic university. The students who put the most into their experience get the most out. So whether it's volunteering, joining a society, being in a sports club, all of these things are at your disposal, and it's about reaching out and taking advantage of them. And I'm sure Karina can reinforce that. It's engaging. There's also a student support and well-being team. There is one at UCL East. We now, in our new UCL East facility at Marshgate, also have a student hub. So you can get help and services, ask questions there as well at any time. There's counseling support, and you can have it at UCL East. You can have it online. So, and we want to be as supportive. If you've got a learning disability, we're here to support you. We're here to help you succeed. So we are located on this new campus at UCL East, and that's a picture of it. Our building now is Marshgate. It's the building there next to that funny looking red, orbit. It's a state-of-the-art facility. I think you'll be mightily impressed if you have an opportunity to come visit. It's also provides a great location to be a student. Also, the University of Arts London is located there, and they have just started their building has just opened up with 6,500 students. So it's a great student community to join. There is also lots of exciting events. There's one of the largest shopping malls in all of Europe is just a short walk from there. There's the aquatic center, and there's a gym on the park. So and then of course there's lots of great restaurants in the area with food from literally all over the world. And then there is student accommodations. UCL does have some student accommodations. There's also private student accommodations in the area. UCL on the left there, you can see Pull Street. That is got I think over 600 beds in those student accommodations that you can also request a place at. So lastly, I just want to say, being in London, studying in London, if you're not from London, you'll be mightily impressed. There's lots that you can do. There's beautiful parks. You can just walk into museums, galleries, institutes. They're all free. There's lots of gigs and festivals and sporting events. And of course, we're on the Olympic Park, which is also the home of the West Ham football team. So if you're love football, soccer, that will definitely be a place that you want to go. And London is rated consistently as one of the top cities to live and to flourish in as a student. So that's the end of my talk. Of course, we've got other upcoming events, but I think I now want to turn it over to Karina and also to take your questions. So thank you so much for your attention. Always know that you can reach out to us. If you've got any questions about applying, you can go to admissionsgbsh@ucl.ac.uk. But we're really excited. We're excited about this program. We're excited about having you join us. So thank you for your attention. Okay, so that's the end of my talk. I'm just going to now move to the chat. If you have some specific questions, please feel free to put them in the chat. Maybe Karina, maybe you could tell us a little bit about your experience and introduce yourself. Tell us a little bit about yourself as well.
Hi, everyone. Welcome to the Open Day. My name is Karina. I'm an international student, and I'm currently a student at GBSH. I've taken Global Healthcare Management, and I've chosen the leadership route. And something about my background, I've done dentistry for my undergraduate, so I'm coming from a purely healthcare background. But interacting with a lot of my course mates, they come from all sorts of backgrounds. It's a very diverse cohort. If you have any specific questions about the course or the student experience, you can put them in the chat box in the Q&A section, and I'd love to answer them.
So tell us, why did you come to GBSH?
Why did I? The first business school for health is monumental. Considering my experience as a clinician, I was very interested in managing the system better, because in my opinion, no matter how knowledgeable or skilled you are as a clinician, you need a good management system to thrive and really deliver effectiveness. And UCL in particular, GBSH in particular, they have so many opportunities for growth, even just beyond the academic curriculum. There's career sessions, there's societies and clubs, as Professor Nora just mentioned. There's so much happening, so many ways to grow. And the networking opportunities. There's so many chances for you to meet people from everywhere and learn from them. So that was really a selling point for me.
And how did you decide on leadership rather than another route?
I'm particularly interested in leadership. I don't know that much about analytics or finance. And while I'm very interested to learn about them, the calling for me was really in leadership. Considering the dental background, I just wanted to make sure I'm in a position to enhance collaboration between different teams in a healthcare setting and drive efficiency.
So tell me, what would you like to do after you finish this program?
I'm really looking at consulting jobs in healthcare. I think that's a sector where I can deliver immediate impact for healthcare organizations, and it's a great place to learn as a person starting out with your career. So that's definitely my first goal after I graduate.
So tell me, do you have a job in London? Are you planning to get a job? Tell me about how you're planning to engage and what kind of activities.
So as for jobs, I'm going to be applying to graduate schemes. If y'all don't know what graduate schemes are, I'll be happy to explain it. Just pop it in the question and answer box. So the applications are actually soon. So I'm currently working on my CV, working on my case interview preparation, and hoping to apply and secure something soon. And the careers team has actually been really helpful. I just had a call with them. So there's a lot of support for people who want to ensure they have a job after they graduate.
So what kind of support have they given you so far?
So far, they've gone through my CV. They've helped me. So I was very confused about how I'm supposed to go about applying for these because the applications close in October, November for a lot of companies. So it's overwhelming, right? Like as a student who's just come to London to have to organize your CV and prepare for job interviews in a few weeks, it's not easy. And they really helped with how to go about it, what I should do first, what I should focus on next. So it's great to have like a guiding hand because it can get really overwhelming as a student.
Yeah, that's great. Well, that's really exciting that you're doing that. And are you planning to join any clubs or get involved in anything else while you're at GBSH?
So I've actually signed up for the 180 Degrees Consulting Society and I've applied to be a consultant there. I'm very excited about it. And I love dancing. So I've signed up for the Tango Club, which again, it's going to be a great break from, all the hectic things happening every week.
Okay, that's fantastic. All right. Does anyone have any questions? You're a very silent group.
I see 3 questions in the question and answer box.
Yeah, I think they're mainly for me, so I don't see. Let me see. Okay, here we go. Hi, Professor Colton. Thanks for the briefing. May I ask what's the difference between the previous session on the 2nd of October titled MSc Digital Health and Entrepreneur with this one? So those are different MSc programs, Grace. This program is for the Global Healthcare Management with roots. And the next one is definitely on digital health and entrepreneurship, which is a different program. And it's focused on helping you develop an entrepreneur mindset and for people who are interested in working in digital health, either as an entrepreneur or within an organization. Then the next question is from Vabhavi. I have completed my bachelor's in occupational therapy. Can I apply for the program? Absolutely. That would be a very good background and really add some, diversity into our program. So we would welcome you to come and join. Then we have, hi, Professor Colton. My name is Fian, and I am from Indonesia. Great. I'm actually going to Indonesia next month. I would like to know deeper into the admissions rate for the Global Healthcare Management Program. Could you provide insights into the acceptance percentage of students in previous years? It is a very competitive program. So I think without knowing for sure the numbers, I would say we had 1,600 applications for this year. And we have taken about, we gave about 250 offers. And I think we have about 220 students who have come on the program. So it is competitive, But I think, being able to apply early is a very good thing, because what happens often is that at UCL and in UK universities, it's a first come first serve sort of system. So those students who put in a very good application early have a higher percentage of getting on the program, and it's really, again, writing a good personal statement. It's not just about your marks. We're really looking to create a diverse community of people to work and study together. And so I think I wouldn't be discouraged by the acceptance rates. It is select, but I would definitely make sure to put in a good application. Regarding the English requirement, I'm still in the process of completing the test. In your view, would it be advisable for me to apply now for the opportunity? I would apply now, because you can get a conditional offer. You'll probably get a conditional offer anyway, and you can submit the English test results later on. But a word of advice, don't wait too long after you get your conditional offer to take the English test. I've seen students who wait right to the end, and then they have difficulties, and it can be really frustrating and disappointing when they're trying to scramble to get the English language score. But do not wait. We do not make our decision, by the way, based on the English language test. That's something that's done afterwards. So we make it on your application. Hi, thank you for your briefing about GBSH. I'm really interested about the program. I work for the government in tourism section, and I specifically handle the health tourism issue. Can I apply for the program? Yeah, that again, and we have a very interesting person on our MBA. I believe he comes from Turkey, who's also in health tourism. So that is a growing area across the world. So Nisha, please do apply. And then lastly, I have a physical disability. Does the campus have reasonable accommodations for me to be able to access classrooms? Absolutely. That's really important for us. And even, can I just say to everyone, if you've got a learning disability or you need some help, we are very conscious of that. That shouldn't be a reason for you not engaging, not coming. And so definitely we will make the adjustments that you need, both in terms of, not only accessing accommodations but also in terms of anything that you might need in your learning space. So Bahavi, please do apply. And then I've got Christine. Hi, Professor Colton. I'm a senior physiotherapist that then moved into case management. I would like to develop to be able to move towards a rehabilitation strategy for organizations such as the WHO. I also have further ideas for digital rehab in the global setting. Would this be most appropriate course for me? What is the difference between part and full-time? Yeah, I think given your interest, this would be the best course for you, would be the Global Healthcare Management. And then you just need to think about where you'd like to add value in terms of route. Probably the leadership might be a good place for you. What's the difference between full-time and part-time? Well, part-time is done over 2 years. So you would take kind of half your modules, as it were. You do have to be enrolled across the year. So how it would work is you take one core module and one specialist module in term 1, one core module, one specialist module in term 2. And then you would take either the research project or the business project in term 3, your first year. And then you would take the other modules that you didn't take in year 2. So, and depending if you're doing the business project, if you're doing the business project, you would need to attend those Wednesday sessions in term 1, but you wouldn't have to attend any Wednesday sessions necessarily in term 2. If you were doing the business project, you would do that in term 2. So that's how we ideally split the program across the academic year. And we do have part-time students. Most of the time they pick their modules on what works in their work schedule at that time. and they negotiate that with their employer, and it doesn't seem to be problematic, and they seem to be able to finish in 2 years. Okay, so are there any other questions? All right, if there's no further questions for myself or Karina, again, always feel free to reach out. We're here to help you. I know it's early days thinking about where you want to go, but the time goes really quick. And so do apply, and we look forward to meeting you. Thank you so much. And thank you, Karina.
Thank you.